Hello, my name is Marta Zinyuk, and this video will be on diabetes mellitus. Diabetes mellitus is a metabolic disorder caused by deficiency of insulin. In this video, I will be going over the pathophysiology, risk factors for the development of both type 1 and type 2 diabetes, what HbA1c is, and medications used to treat diabetes. The role of insulin is extremely important in understanding diabetes. Insulin helps control blood sugar levels by signaling the liver and muscles and fat cells to take in glucose from the blood. Insulin, therefore, helps cells to take in glucose to be used for energy. If the body has sufficient energy, insulin signals the liver to take up glucose and store it as glycogen. Functions of insulin include glucose uptake, glycogenesis, lipogenesis, and protein synthesis of skeletal muscle and tissue. Type 1 diabetes. Type 1 diabetes, which is also known as insulin-dependent diabetes mellitus, is a chronic illness categorized by the body's inability to produce insulin due to the immune system destroying pancreatic beta cells in the pancreas. Insulin is produced by the beta cells of the islets of Langerhans located in the pancreas, and the absent destruction of the cells results in inability to produce insulin. And insulin is extremely important in regulating blood glucose. And type 2 diabetes, either the body does not produce enough insulin or the cells ignore the insulin. It usually begins as insulin resistance, a disorder in which the cells do not use insulin properly. When the need for insulin rises, the pancreas gradually loses its ability to produce it. The next thing I will be talking about is the risk factors. The risk factors of type 1 diabetes are family history, viral exposure, high birth weight, autoimmune conditions, ethnic background, and advanced age of mother-child birth. The risk factors for type 2 diabetes are family history, obesity, physical inactivity, race and ethnicity, fat distribution, age, and high blood pressure. The next thing we will discuss is the complications, pathophysiology, and preventative measures and treatment. Some complications of diabetes are hypoglycemia, which occurs when there is too much insulin or too little food intake. The drop in blood sugar level in a diabetic client causes release of epinephrine, cortisol, and glucagon, leading to dizziness, sweating, confusion, poor coordination, and unconsciousness. Preventative measures and treatment are glucose tablets and or fruit juice. The next complication is DKA, which is lack of insulin or an elevation in stress hormones. Due to lack of insulin in the body, begins to burn protein and fat for energy, which results in ketone buildup. Preventative measures and treatment include insulin, saline, and potassium replacement. The next complication is HHS, in which blood glucose is extremely high for a really long period of time, leading to severe dehydration. Preventative measures and treatment are rapid rehydration, insulin administration, and treatment of the underlying cause. Next is HbA1c, and this test measures blood glucose over a prolonged period of time, and it is extremely important because the results determine the average blood glucose level for the previous 2 to 3 months. This is important in determining if the patient with diabetes is managing it ultimately successfully or not. Some medications that are used in treating diabetes are sulfonylureas, which is used to treat type 2 diabetes by lowering the levels of glucose in the blood by stimulating the production of insulin. It is an oral anti-diabetic drug. Another medication is meglitinides, which lowers blood sugar by stimulating the release of insulin by beta cells of the pancreas. These are my references, and thank you for listening.